It's Mari McInerney from Croakey here at the Equally Well Symposium in Melbourne, and I'm sitting here with Lucy Brogden. Lucy, would you be able to introduce yourself, please, and your role?
Hi Mari, Lucy Brogden, Chair of the National Mental Health Commission Advisory Board.
Thank you very much. Now, you've given the opening keynote here. Could you map the issues we're talking about here at the symposium?
So the Equally Well Symposium brings together for the first time nearly 200 people to look at how we actually implement the Equally Well consensus statement. And what that means is, how do we create a strong platform across the health sector and actually across the community to improve the physical health outcomes for people with severe and persistent mental illness.
Now, they are bad outcomes. Can you run through some of the headlines there?
So the tragic headline is that today in Australia in 2019, someone with severe persistent mental illness has a life expectancy 25 years shorter than the rest of the population. And so that's just a tragedy by any stretch of the imagination. But really the thing that makes it even more tragic is that these deaths are preventable. If we get in early on both the mental illness and the physical illness and tackle those early, we can prevent these early deaths and the onset of more significant illness.
Okay, so to do so is clearly a very complex thing, but you said we're talking about change to practice, change to culture. What are those issues about?
So I think this is, it's a collective impact approach to doing this, so we are working right across the sector. To date, the work has been fantastic in really using the literature to understand the issue, to quantify the issue, to map out strategies and to define good practice. But good practice only goes so far. We have to actually bring this in as part of the culture and the way we operate, how things are done around here. And that's the tricky part. Across industries it's hard. We've seen the questions of culture in the banking sector, we've seen them in the aged care sector, we're seeing them in the mental health and disability sector. How do we actually create a mindset that values mental health and physical health equally? And I think that's what this symposium is going to be looking at today.
What do you find in the system, in the health system, the mental health system and overall? What is the barrier to that cultural change?
Look, I think the barrier to a lot of the cultural change has been traditionally our very siloed approach to training of clinicians, whether that's medical or allied health, or community workers for that matter, and it's quite encouraging to see that more and more undergraduate programs are bringing students together in the early days of their training, but that siloed approach to training and care means poor outcomes for people at the end of the day. So I said in my speech today, we need to move beyond collaboration, sitting around the table planning the strategy, to actually integrating it into everything we do. And then I think that way we start to create the value that we're looking for.
You recently attended, I think, a global ministers conference. So where is Australia fitting in all of this, and where can we find leadership?
October last year we had, I was pleased to represent Australia at a global health ministers conference looking at mental health and suicide prevention in London, and it was fantastic to be part of that group. And I think something that made me particularly proud is just the leadership we have in certain program designs, where we're at in our thinking and service delivery. We've still got a long way to go, but on many benchmarks we're certainly punching well above our weight. What was exciting at that conference was the opportunity to also have a conversation around the concept of equally well with colleagues from many different countries. And I think the strength that we have is that we're doing this. We're working with New Zealand, we're now working in the UK, and there's appetite in Europe to take this further, recognising that most countries, whether they're developed, tier one, or developing, whatever language you put around that, most have a good physical health model. And how do we leverage that to work with people with mental health issues as well? So a lot of upside for us.
We've got the Productivity Commission set to inquiring into mental health. You talked about how it was very important for them to look at the social determinants. Can you talk about that as an issue here?
For us, for the National Mental Health Commission, from day one we've said that many of the levers that we have as a country to pull around improving the mental health and wellbeing of all Australians sit outside of health. And so for us, we have for a long time used a social determinants of health model that looks at housing, accommodation, equity, gender equity, community services, urban design, all these elements go into creating good well-being for people. So it was important for us to really work with our minister, with Treasury, and now with the Productivity Commission to create this model and explain this model so that they can really look at the true costs of mental health and mental ill health, but equally understand the real opportunities of getting it right.
How do you feel heading out of this then today, the symposium here? What would you like to see come out of it? And where's the where to from now?
Look, I think the where to from now has really is articulated right across the agenda. People have been doing some great work in various strategic aspects of this challenge. The lived experience has a strong voice here, talking about issues to do with language, service design and service delivery. But it's also great to see on the program that going forward, the clinical sector is really embracing the opportunities here. And colleagues from New Zealand were saying that they're a little way ahead of us in this journey, are seeing great feedback from clinicians who say they're getting so much more out of their role by embracing a much more holistic approach to the care of their clients and patients. So I think the where to is to make this live and make it real.
Thank you very much, Lucy. And did you have anything else that you wanted to say out of what you brought to this, or what you're hoping to hear emerge?
Look, I think you touched on it in terms of the direction of the conference, is to just make this happen. Too much talk, time for action.
Thank you very much for your time.
Thank you.